Sorry. Arouses the ego to take defensive action against the pressures from within.
ఎవరు పెట్టుకో మనమే.
Anji, what? Is it visible?
Yes, sir, it is visible.
Okay.
Yes, it's visible.
So, journal how to deal with stress. Some suggestions on ways of dealing with stress are the removal of unnecessary stressors from lifestyle, and do not allow neutral events to become stressors, and develop the skill in dealing with stressors and seek relaxation. This is journal. Now we will start with anxiety in general medicine, modern medicine. So different types of anxiety disorders are the generalized anxiety disorder or the GAD. This is a chronic disorder characterized by excessive anxiety and worry about various life circumstances. Patients who have generalized anxiety disorder are pathologically anxious about everything. They are generally mistrustful of their own level of competence and basic merit. Environmental factors are more important in the etiology of the GAD. Emotional conflicts in the early childhood interfere with the normal development of the personality, especially when there is genetic predisposition. When this abnormal personality is confronted with everyday stresses of life, the defense mechanisms which are used to anxiety normally become inadequate and fail. The common symptoms of this GAD are palpitation, trembling, excessive sweating, and dryness of mouth, breathlessness, chest pain, abdominal pain, headache, and heaviness of head, dizziness and unsteadiness, frequency of urination, diarrhea, and disturbances of sleep. Other general symptoms include hot flushes, cold chills, numbness or tingling sensations. The common signs are elevation of blood pressure, tachycardia, increased aspiration, and sweating. This GAD has to be ruled out from thyrotoxicosis. In the thyrotoxicosis, there is thyroid swelling, exophthalmia, and abnormal thyroid function, which suggests thyrotoxicosis. In addition to this, there is cold and moist hands, which are common in the anxiety disorder, but in contrast to warm and moist hands in thyrotoxicosis. Post-traumatic stress disorder. This condition develops in persons who have experienced extremely traumatic emotional or physical stress with either actual or threatened death or injury to oneself or another. Such traumas include war experience, natural disasters such as earthquake, rape, and disasters as fires in the buildings. The clinical manifestation of this PTSD are re-experiencing of the trauma through dreams and waking thoughts, emotional numbing to the other life experiences. Associated features of autonomic instability, depressive ideas, poor concentration, and panic attacks. These disturbances cause clinically significant distress or impairment in social, occupational, or other areas of functioning for at least 1 month. The patients often actively avoid stimuli that precipitate recollections of the trauma. The next is phobic disorders. A phobia is a marked and persistent fear resulting in the conscious avoidance of a specific feared object, activity, or a situation. The patient avoids the phobic stimulus, and this avoidance usually impairs his occupational or social functioning. The affected individual is aware that the experienced fear is excessive and unreasonable given to the given circumstances, but he cannot help it. Agoraphobia is a type of phobic disorder, is the fear of public places. The patient tries to avoid such places or situations where escape may be difficult. The patient avoids crowds, public places, traveling away from home, or alone. Agoraphobia is usually associated with panic disorder, but there exists a subgroup without panic disorder. The next type of phobia is social phobia. It is a specific fear of social or performance situations in which the individual is exposed to unfamiliar individuals or to possible examination and evaluation by the others. This is different from agoraphobia, where the patient is not bothered about the reaction of the other people. Examples include having to converse at a party, use public restrooms, and meet strangers. Simple phobia are specific phobias not covered by social phobia and agoraphobia. It is further divided into 5 types: animals, aspects of natural environment, blood, injection, injury, situational, and other. Common examples of simple phobia are fear of heights, fear of closed spaces, claustrophobia, fear of flying, fear of animals, fear of lightning and thunderstorm, fear of darkness, fear of blood, and fear of crossing streets. The next type is obsessive compulsive disorders. So obsessions are persistent, recurring ideas accompanied by a subjective feeling of compulsion, which the patient tries to resist but cannot get rid of. Compulsions are irresistible urges to carry out irrational activities. The patient knows the irrationality of the obsessions and compulsions, but cannot prevent them. When he tries, the emotional tension mounts and he becomes miserable and exhausted. These obsessions and compulsions restrict the social activities and interpersonal relationship of a patient. The clinical manifestations of this OCD are, there are 4 major patterns. The most common is obsession of contamination, followed by washing. The second most common is obsession of doubt, followed by compulsion of checking. The third is merely and intrusive obsessive thought without a compulsion. Such obsessions are usually repetitious thoughts of some sexual or aggressive act that is reprehensible to the patient. Fourthly, there is obsessional slowness, in which the obsession and compulsion see the patient excessively slow in carrying out daily activities. Such patients can take hours in taking a bath or eating, etc. Then the next type is panic disorder. For panic disorder, we will have to first understand the panic attack. The panic attack, it is a period of intense fear characterized by a group of symptoms that develop rapidly, reach a peak intensity in about 10 minutes, and generally do not last longer than 20 to 30 minutes. Attacks may either be spontaneous or situational. So sometimes these attacks may occur during sleep also. The nocturnal panic attacks are rarely physiological symptoms of anxiety, may occur without psychological component. That is non-fearful panic attacks. So panic disorder is the recurrent panic attacks which are not secondary to substance abuse, medical conditions, or another psychiatric condition. There are distinct episodes of intense fear and discomfort associated with a variety of physical symptoms. The frequency of occurrence may vary from many attacks a day to only few attacks a year. There is usually the persistent worry of having another attack or consequences of attack, which may lead to phobic avoidance of places or situations and significant behavioral changes related to the attack. The clinical features of this panic disorder. The diagnosis of panic disorder is based on the following criteria. A separate period of intense fear or discomfort in which 4 or more of the following symptoms are developed abruptly and reach the peak within 10 minutes. The first one is palpitations, pounding heart or accelerated heart rate, sweating, trembling or shaking, sense of shortness of breath or smothering, feeling of choking, chest pain or discomfort, nausea or abdominal discomfort, feeling dizzy, unsteady, lightheaded or faint, fear of losing control, fear of dying, and the chilly type sensations. In some individuals, this anticipatory anxiety develops over time and results in a generalized fear and progressive avoidance of places or situations in which panic attacks may occur. Researchers suggest that individuals with panic disorder had a significantly higher rate of supporting gastrointestinal symptoms, including those typically associated with irritable bowel syndrome, than those with other or no psychiatric diagnosis. The differential diagnosis for this PTSD, a wide variety of this conditions may present as a panic disorder, that is substance or alcohol misuse, mood disorders, or other psychiatric disorders secondary to medical conditions, and the mood disorders or other psychiatric disorders secondary to medical conditions. And the medical conditions presenting with similar condition, example, hyperthyroidism, hypoglycemia, anemia, mitral valve prolapse, tachycardia, coronary heart disease, epilepsy, asthma, etc. For the diagnosis of anxiety disorders, as per the Diagnostic and Statistical Manual of Mental Disorders, the symptoms of anxiety should be of such a level so as to interfere significantly with the person's normal routine, occupational, academic functioning, or social activities or relationships. So anxiety disorders, comorbidity with depression, anxiety is closely related to depression. So in a clinical situation, the symptoms are often difficult to differentiate. In a meta-analysis, the prevalence of anxiety disorders in patients with depression has been estimated at 57%. So a new category, mixed anxiety depression, is being proposed. The anxiety far more commonly precedes depression than vice versa, and that particular episodes of depression may begin with anxiety symptoms. Anxiety involves an attentional bias for threatening information. Thus, when given both threatening and non-threatening clues, the anxious patients attend selectively to the threatening clues. On the other hand, depression involves a memory bias, with depressed subjects showing a bias to recall negative information, particularly when it is self-referential. Now we come to anxiety disorders, and we'll try to study it through homeopathy. So Dr. Honeyman has classified the mental diseases into 4 types. The first type he describes as mental diseases appearing with the decline of corporeal disease, which threatens to be fatal, the somatopsychic. Dr. Honeyman refers this type of mental disease in aphorism 216. In this type of diseases, there is quick and dramatic transference of physical disease becoming mental disease. In this type of mental disease, the so-called physical disease declines with the rapid increase in the psychic symptoms. Finally, the physical symptoms become insignificant and improve almost to the perfect health, and the person is in no more danger of death. So in this way, the physicals or the affections of the grosser corporeal organs become transferred to the spiritual, mental, and the emotional organs. So examples of this is a suppuration of lungs gets transferred to insanity. The second type of mental disease Dr. Hanuman describes is mental disease appearing suddenly as an acute disease in patient's ordinary calm state caused by some exciting factor. Hahnemann refers to this type of mental disease in aphorism 221. In this type of diseases, an insanity or frenzy that suddenly breaks out as an acute disease from the patient's usually quiet state may be occasioned by fright, vexation, drinking alcohol, etc. But it almost without exception springs from the internal sora. He further says that during acute phases, deep acting remedies are not needed, but mainly the remedy that corresponds to the acute picture only. So it must be treated with medicines such as aconite, belladonna, stramonium, hyoscyamus, etc. in a high potency. This will control the acute flare-up to such an extent that sora returns to its previous almost latent stage, whereupon the patient appears to be recovering. The third type of disease is mental diseases of the doubtful origin. In this, Hahnemann refers to this type in aphorism 224. In this, he refers to a certain type of mental disease where it is difficult to ascertain the cause of them. It is not sure here whether the diseases are from physical affections or some psychological affections. Various causes attributed are fault of education, bad practices, superstition, and ignorance. The fourth type of mental diseases is mental diseases arising from prolonged emotional causes or the psychosomatic. Hahnemann refers this type to aphorism 225. In comparison with the first type of diseases, there are few emotional diseases that have not developed from physical diseases. These diseases originate from the emotional causes such as persistent anxiety, worry, vexation, abuse, frequent fear, and fright. This is in contrast to the first type. In this, the body is little affected in the beginning, but as the disease progresses, it affects the physical health to a great degree. While Hahnemann did not make any difference between psychosis and neurosis, he differentiated between the physical disease extending into mental disease or somatopsychic disease and a psychological condition extending into physical disease or the psychosomatic disease. Vitolkas puts people with anxiety as difficult cases. He says, as they are excessively anxious about their health, these people tend to relate a tremendous volume of minute symptoms that cannot be valued highly by a homeopath because of these patients' tendency to exaggerate. The symptoms of such patients should be chosen with caution and with the information of these, confirmation of these by the objective co-workers or relatives. So according to Dr. Ortega, anxiety is preeminently soric. Its psychotic equivalent is fear and has a syphilitic color in panic. Anxiety is conceived as the outcome of man's first sensation of birth when it abandons the maternal enclosure in which it lives with practically no effort. When he passes to outside, and there he must work steadily to exist, from oxygenating his blood to taking in food, digesting it, secreting it, submitting himself to various movements. All this combined with the aggressiveness of external environment stamps on him a feeling of worthlessness, of relative incapacity, which is translated into anxiety or existential anxiety. So this existential anxiety grows within us. When it grows within us, it becomes anguish, which is more destructive and has markedly syphilitic tinge. But all these symptoms, anxiety, fear, and anguish, have a soric base, turning into fear when it has a psychotic admixture and anguish with a syphilitic one. If your fear is externalized and it increases, it becomes a panicky terror that has a syphilitic base. Now we will have a case of PTSD. In 2005, earthquake occurred in this Jammu and Kashmir region, rather in the northern India. So the name of the patient is Sukhvinder Singh, age is 12 years and a student. The presenting complaints were fearful, vertigo, and sleeplessness, irritability, and he startles from the slightest noise. The history of the present illness was that all complaints started since the 8th October 2005 when the earthquake struck. He was in the school when the earthquake struck and there was a stampede in the class. In this process, he fell down and received some injuries also. The walls of his class cracked from this. It was his first experience with earthquake of such intensity, and it was full of horror for him. He has constant fear of earthquake happening again, is sleepless due to frequent waking, and aggravation from the slightest noise. Since the quake has struck, he prefers to remain outdoors, even sleeps in the open, irritable from the noise, from shouts from anger, he startles from the slightest noise and touch. There is vertigo and dizzy feeling, which started after the earthquake. So no, and nothing of more weather. And the next is the appetite is diminished, the stools constipated, and there is sleeplessness from disturbed sleeps, from fears, and from slightest noise. The dreams are frightful, waking him. The thermal state is hot. The emotional state is anxious, fearful, and apprehensive. And he is the only son of his parents. Both parents are working, and the patient is cared by his grandparents. He is described as very sensitive child by the parents, gets scared easily, good in studies and extracurricular activities, has lost interest in things which he used to enjoy since that episode. So the diagnosis is this PTSD, post-traumatic stress disorder. We reprise the case using the following symptoms: fright complaints from, startled sleep during, and the startled fright from, sensitive to the noise, and vertigo fright after. So aconite and opium they were both covering all the symptoms. So opium was preferred over the aconite. So opium one dose was given with placebo for 2 weeks. He came back on 26th November and was better. Vertigo was almost fully better. No gets comfortable sleep, and sensitivity is also much better. Prescribed placebo for 2 weeks. Again on 15th December, he was better by more than 70%. There is no vertigo. Appetite has improved. Constipation is also better. The frightful dreams are less now and not much disturbing. The placebo for 1 month. And then again in January 2006, the patient is now better in all respects. His appetite and constipation are better. His temper is also under control. The sensitivity to noise is now normal. The starting from sleep and frightful dreams are also not disturbing now. And then placebo was given. And in March 2006, he was better, no complaints, and placebo again. So discussion of this case presented to us with the post-traumatic stress disorder, which was there due to the earthquake in the northern India on this 8th October 2005. The case had a strong mental causation, which deranged a perfectly healthy child to an abnormal one. The following drugs, opium and aconite, were given preference as they as I covered the causation and the prominent symptom, but I go right after. Opium was given preference of over aconite as the fear of death predicts the day of death. A grand characteristic of aconite was absent in this case. Also, when we refer to nerve rapture in the mind section, a following rubric was found in favor of opium. Mind after fright, fear of fright still remaining. Fear of fright still remaining after fright. So on this basis of this acute condition, this high potency of opium was given as a single dose. So as continued progress in the improvement of general state continued, opium was not repeated. That's all for me. Poonam.
Thank you very much, Dr. Dhari, Dr. Dushyant Dhari. It was a very enhancing, knowledgeable lecture.
Thank you.
Now, there are some questions from my side. What is the difference between the anticipation, anxiety, and nervousness? How will we differentiate? Anxiety, anticipation, nervousness.
Anticipatory anxiety is mostly in relation to some situation, or just like in exams, or we have to prepare for exam, or we have some function is there for which we have to prepare, or which that comes under mostly under anxiety, anticipatory anxiety.
Okay. And how will we differentiate it between the depression and anxiety? Some people say anxiety as a depression. So how will we differentiate that?
Anxiety, as I said, in there is only anxiety and depression. They are mostly found side by side. But the characteristic which differentiates them is that anxiety is mostly with helplessness. The keyword is helplessness.
Okay.
And for depression, the keyword is hopelessness.
Right.
And the anxiety is mostly for the future events which are yet to take place.
Okay.
While the depression is mostly for the events that have taken place, the past.
So may I ask anybody who wants to ask any question from the speaker, Dr. Dushyant Dhari, or should we proceed further? So now may I request Dr. Manjeet ma'am, Dr. Manjeet Kaur, will she be able to summarize? Sorry, sir, there is a question before I do. There is a question, can anxiety and depression coexist?
Yes, they can coexist.
Yes.
In mostly in around 57% cases, they coexist. Comorbidity of these are there.
Okay. Thank you very much, sir. Now I will request our national advisor, Dr. B.S. Chandok, sir, to summarize the lecture. Am I audible? Sir, please join the room. Dr. Chandok, sir.
Am I audible now?
Yes, sir. Okay.
Isn't Dr. Muktinder Singh there?
No, sir. That's why.
Okay, it's okay. It's okay. It's okay. Well, Dr. Dushyant Dhari, it was nice meeting you after a long time and seeing you after a long time. Your very explicit, very straightforward explanation of today's subject has been very professionally fruitful to all of us, all the 38 doctors, those who attended this webinar. Anxiety and depression. See, in homeopathy, I believe every homeopath, for us, mind symptoms are very, very important, and we do go deep into the history of the mind whenever any patient is with us. And the patients also recognize that it's the homeopath who can help me out. So when a patient of anxiety, if it's an acute anxiety, it's only anxiety. If it's a chronic anxiety, patient is definitely in depressive state. As this question has come up twice, thrice. So Dr. Dushyant also said both they can coexist. I believe it can coexist in much more percentage of cases, because wherever there is depression, anxiety is there. And if anxiety is very old, then a person is likely to be into depressive state. So this is a very, very common state of mind what we people get in the clinic. And today's detailed explanation, giving a clear view that anxiety and depression, they come in psoric miasm. This is also very interesting. Although we have been reading in miasm 291 about this, but again, when a patient of depression comes to us, we do at times think that this case is more towards the psychotic state or even syphilitic state. So your throwing light on this is also helpful. And obsessive disorders, what you also touched in between. This is also a very common state of mind, very common problem what we get in our clinical experiences. And you have touched that part also. I believe such common topics, when taken up in the webinars, are of great value and great help. I will thank Dr. Dushyant Dhari once again on behalf of IIHP. Dr. Manjeet is also there. Dr. Manjeet,
Yes.
Are you comfortable saying something?
Yes, my net was unstable, so I couldn't speak before.
Please.
So Dr. Dushyant is our old student from Homeopathic College.
Yeah.
He was a very good student that time also. And yes, really, it is a very vast topic. Anxiety disorder is not one disease. It's a vast topic. It's a whole, you can say, a rainbow of diseases. Many diseases come under this umbrella, anxiety disorders. And we have so many here. Dr. Dushyant has told in detail all the names of the diseases. And sometimes we get patients in combination, in 2-3 problems they come. They come depression also, anxiety also, OCD also. And the more interesting part is there is big branch of psychiatry, but they don't have any treatment. They only give antidepressant, anti-anxiety, and years the patients are taking. Some improve also, but mostly the patients, they come to homeopathy at last for the treatment. And we have very good treatment for all the diseases, all these problems. Even I have seen many OCD cases, I have cured many OCD cases, completely their OCD has gone. Compulsion has gone with the homeopathic medicines. And we have to see, this is the stress over the constitution. It's because the environment these days is becoming more and more stressful. And because I'm practicing for I think more than 40 years. So earlier I used to see patients like above 50, above 40 with this disease, even above 60. Now I'm seeing these diseases in children also, in school children also, in students also, because of the increased stress of studies. And especially ladies and even males, the corporate people, they are all come under this problem, and we have a complete cure for all these diseases. A very good results. And all the miasms are responsible for this. This we have to see, and the main thing in the treatment is that we have to see how the constitution is responding to this stress. That is the key to treatment. Thank you very much.
Dr. Manjeet, like stress basically is such an important part of almost all the diseases. And in homeopathy, usually we get chronic cases, autoimmune disorders. So whenever we treat any autoimmune disorder, it is just not possible to proceed in an autoimmune disease unless we are able to make a catharsis of the cause of the patient, cause of the disease. And I've seen wherever how जितनी मर्जी chronic, pathologically advanced, or nomenclature wise, it might be any kind of dreadless disease. If we are able to find out the cause of why the patient has gone into that doom, what is responsible behind the patient's deterioration of health during his lifetime, I think then there's no dearth of success in homeopathy.
That is the basic. First, we have to see the basic constitution of the patient. What is the we see the basic constitution of the patient. What is the personality of the patient? Then what is the stress? And the same stress that some people they can take very easily, but some people they break down.
Individuality.
And this again individuality comes. Where is the threshold? Then how this constitution is responding? Wo keh raha hai usko, us stress se. Some people they are taking it, but some people they can't take it. And here we have so many cases, even housewives, students, teachers, professors, corporate officers, everywhere we're seeing this disease. Or now it is increasing, where the physical pathology is coming down and these mental disorders are coming up. Physical is not coming down, but mental disorders are increasing.
Yeah.
And we have an answer. Homeopathy has an answer for that.
Exactly. Mental depression, mental states, if it's deep-seated, it definitely results into adverse pathology, no doubt in it. And it's today, after, listening to this primary basic part of this anxiety lecture, I think, Dr. Manjeet, this is very important that we take up anxiety on a wider platform. Because anxiety, stress, these are, if I would not be wrong in saying this is the pivot of causing all the chronic, critical, autoimmune diseases and pathologies. So we will take it up, Dr. Poonam and Dr. Kavita. For coming webinars, we will be taking up anxiety in a wider form. Discuss it with Dr. Manjeet, Dr. Muktinder Singh. We will have a joint discussion and we will decide about the topics. And Dr. Dushyant, please explore also for any other topic if you want to speak in this particular anxiety-related disorder, because we want to look more deeper into finding the stress, causes of the stress, and treating the patient on those bases. This is the field where homeopathy has an edge. We have a very, very advanced edge over the other modern systems or the medical systems. And I think this will give us much more push. Now, I am watching Dr. Deepak Sharma's presence in the group. If Dr. Deepak Sharma is listening to me, is Dr. Deepak Sharma from Muscat?
Yes, seems so.
Yes,
It's the same
Dr.
doctor,
Deepak
right?
Sharma?
Yes. Sir, one request, sir. Are you on 2 devices? Because actually your voice is echoing.
Yes, I'm using 2 devices. I'll switch.
So kindly
switch
yes,
it
sir.
up. Switch in the one.
Okay. All right.
And Dr. Deepak Sharma, I did notice, I think he's the same doctor from Muscat.
Okay, Dr. Deepak. Dr. Deepak. Well, we are looking for Dr. Deepak to give us a webinar someday. He is a wonderful colleague, very, very, I would say, a doctor with a great experience. And okay, I'll get in touch with him. I believe he's, but he's very much present in the meeting. Yeah, he's there. I'm calling him. He's not picking the call. Dr. Deepak? Dr. Chandok from Chandigarh. Are you attending the webinar? बढ़िया. Are you attending a? तो सर मैं आपको बुला रहा हूँ ना, आइए ना उसमें, मैं आपको बुला रहा हूँ. प्लीज स्विच ऑन योर माइक. हाँ, या he is attending the webinar. That's nice.
नमस्कार डॉक्टर साहब.
Namaskar. Wonderful. I could see your picture and I was really excited. हम तो भैया आपको बहुत देर से my whole team is asking me कि डॉक्टर दीपक सर को ड्रैग करो. मैंने कहा बिल्कुल, उनको अभी wonderful. Very to be very frank, Rao sir is also on there in the. He's online. I mean, I know he's watching, and I'm sure he will also be very happy to see you. Rao sir, are you there? So
yes, I am very much there. Dr. Chandra, I am very much there. Hi,
ये मस्कट से यहाँ पे बैठे हमारे हमको सुन रहे हैं. Wonderful. So welcome, great welcome, and audience, I must introduce you. Dr. Deepak Sharma has attended our recent few conferences, national conferences. He was very much there in the Panchkula conference. And having listened to him, the entire audience really demands him. And he is such a wonderful human being. His wife, such a sweet lady, is a wonderful son of his parents, and a great doctor in Muscat, very, very successful doctor. And sir, now तो अभी audience के सामने request कर रहा हूँ कि एक बार पहले की थी आपको, तो अभी आपको request कर रहा हूँ कि give us a time in any of the further, we do it once in a month. And we would like to definitely have you on an international stream. We will, spread this message wider throughout the international, in our international group. Dr. Rao sir is there. He's the international coordinator, so you know him better. He also always deals with.
You just order me. I will be there at your service. This is.
I will. Doctor, मैं आपसे अभी 1-to-1 personally, maybe in a day or so, I will communicate further for the subject, title of your lecture, and we will come up soon. अभी जैसा हम बात कर रहे थे कि anxiety disorders and diseases caused by the stress, as तो इसी को लेके कुछ अगर if you come up please, so it will be wonderful. We can continue with this series.
Yeah, sure. I see almost 10 patients a day of anxiety neurosis.
I know you are very, very doing great job, and we are thankful to Dr. Rao who brought you here in Panchkula and made us all meet you. So
आप मुझे सिर्फ टॉपिक बता दीजिए किस पे बात करना है, उसमें मेरे
चलिए मैं डॉक्टर दीपक आपसे बात करूंगा maybe in a day or two. I'll send you a text and then as per your availability we will proceed. Thank you very much for joining today. Thank you very much.
Thank you, sir. I just happened to saw the link. मैंने ऐसे ही देखा. Some Dr. Poonam was inviting to join, and that message came on my screen. I said, what conference is there? So coincidentally, that time I was a little free, so I joined. And it was a pleasure listening to both the speakers.
Chandigarh State Branch, see, as Dr. Rao, during the COVID, all organizations went into hibernation, but it was the IIHP which was having its flag flying high. So during the COVID, we started with the national webinars, IIHP national webinars, and then finally, it slowed down. But in this Chandigarh State Branch, we thought of giving a webinar one day, and I just came to my mind. I talked to my team, Dr. Kavita, Dr. Poonam, how about making it a webinar a month? So they said, sir, we will be too glad to work for it. So we changed the title, Webinar a Month. This was the slogan. And with God's grace and Hanuman's grace, and the support of Dr. Rao and all, Dr. Muktinder Singh has been a big support. We are holding a webinar every month since last 10 months now.
Yeah, you just let me know whenever you need me. Give me a week's notice, and I can present whatever topic you
Wonderful,
choose.
wonderful. It will be a great service.
Thank you.
Thank you.
So, now we should request our President sir, Dr. MP Rao sir, to speak few words. आप उनको invite करो.
Yeah. Dr. Rao sir, please. आइए आप अभी आपकी आवाज तो सुन ली, पर आप थोड़ा बोलिए भी.
Am I audible? Am I audible?
Yes sir.
Yes, sir.
Yes.
Yes, sir.
Yeah. Good evening, Chandigarh and Dr. Chandok.
Thank
and,
you, sir.
Please, sir.
Deepak
Good evening,
Sharma
sir.
from Oman. It's
Thank you.
nice to see you, all of you, today in this webinar. Generally, what it so happens, people start with the great enthusiasm and stop in the middle after 1 or 2. But for the past 10 months, the Chandigarh State Branch, with the support of Dr. Chandok, is continuously organizing monthly seminars. It's really heartening to see every month bringing all different specialists, speakers on different subjects. Because what many of we doctors think like that, there is no need for us to understand. But after hearing today Dr. Dushyant Dhari, especially in the anxiety disorders, and when he explained about the panic disorders, naturally I felt that how much we have missed this. So we day in and day out we are seeing that, but nitty-gritties of treating these panic disorders, he has beautifully explained. So this way we are able to learn every month a new thing. Especially on behalf of IIHP National Executive, I am very much thankful to the Chandigarh State Branch and Dr. Chandok also for continuously giving knowledge and to refresh the practitioners. Because there are only 2-3 from IIHP side regularly going on. One is we are doing with the Canada OHMA. Every month we are doing that. And to Delhi people also, they are organizing every month. And also our mission programs, almost every other month, they are also organizing this. This way, I expect that the other state branches also, they should take lead and organize and let Chandigarh be the role model for these monthly webinars.
Thank you so much.
Thank you
so much, sir.
Thank you, Dr. Kavita and entire her team and their mentor, Dr. Chandok and Dr. Muktinder Singh. So for taking forward these learning programs. Thank you very much, and thank you very much for giving an opportunity to speak to you all people. Thank you very much.
Thank you very much,
Thank
sir.
you, sir.
Thank you, sir. Thank you so much.
Dr. Kavita, vote of thanks.
Yes, sir. I today will be finishing on a beautiful note because the lecture has been excellent. I thank Dr. Dushyant Dhari because he gave us a very beautiful idea about all this anxiety and neurotic disorders which we are facing with our patients in our day-to-day practice. So first I have to thank him because he is the main person who gave us this beautiful topic and explained things to us. Then I will thank Dr. Rao sir, who is our immediate past president and chief international coordinator, for guiding us and being there with us all the time and
Call him the backbone of IIHP.
Yes, he's the backbone of IIHP and helping us out with every month holding the seminars. So we are having his support. So that is why we are flourishing. So it's a very big, it's a thanks from our end to him, which is actually too less because it's, this is a continuity which is going on, and I am sure that, we are going to further progress with our webinars. And it's going to be like, we'll be completing a year soon. And I'm sure we are going to progress even after that. And okay, so this is about our Dr. Rao sir. But then here we have Dr. Deepak Sharma, who has come from our Muscat side. So even he has attended this webinar, which has been a highlight actually, because we hardly expected him. And to our surprise, he's with us today. And it was very nice listening to him during the Panchkula time, as well as his lecture in the last February at Hyderabad. That also I attended, and I was very happy to attend to his lectures there. So yes, we need him once again in our webinar so that we can get his teachings and we can learn a lot from him. Then I will thank Dr. Mahesh Pagdala, the National Finance Secretary, who was attending. And next, I would thank the Chairman, National Scientific Committee, Dr. Muktinder Singh, sir, because he's the one because of whom we are able to get our Zoom links, who's helping us in every aspect of our holding these webinars. He has been there right from the beginning, and I'm sure he's going to support us further. Then I had seen the appearance of Dr. Harprakash Sharma. I think he's not present at the moment.
Yes, he was
Dr.
there.
Harprakash.
Dr. Mitchell was also
Yes.
there.
Dr. Vinod Sangwan, Dr. Vinod Sangwan sir, and Dr. Vittal sir. So these are our very senior doctors who were there with us. But right now, I think after the webinar, they have left. So, and I thank all the other dignitaries. I thank Dr. Manjeet Kaur ma'am, because she also adds a lot of sparkles to our webinars, being there.
She's our power backup, right? Inverter.
Yes, she's our power backup, no doubt, no doubt, no doubt, absolutely. And with her, we do get powerful, no doubt. And I thank all our audience for being there and hearing us and supporting us. Thank you, everyone. Thank you, everyone, for this beautiful webinar. Thank you so much.
Thanks to you. Thanks to all.
Thank you, Dr.
Good night,
Poonam.
everybody. Good night.
Good
Bye-bye.
night, everyone. See you
Goodbye.
in the
Good
next
night.
webinar now.
Yes, the next smart webinar.
Yeah.
Thank you.
Thanks a lot.
Thanks.
Core group
Thanks
stay
a
on.
lot.
Thank you.
Core group stay on.
Yes, sir.
Hi,
Yes,
Dr.
sir.
Deepak.
Hi.
Thank you, Dr.
Bye,
Pagdala.
everyone.
Thank you.
Hi.
अरे
Thank
यार
you,
डॉक्टर
right.
पगडाला भी थे, अभी इनको तो बुलवाना चाहिए था
Thank you. Thank you, Dr. Chandrak ji, Dr. Kavita ji.
हमें
Thank
लगा
you.
आप निकल गए तो
Thank you.
आपको तो बुलवाना चाहिए था. चलिए next time we will. Thank you very much. Thank you.
Thanks a lot.
Bye bye.
Yeah.
Thank you,
Core
Dr.
group.
Chandok. See you soon.
Sure, sure. Sure. मैं तो सोच रहा था कभी मस्कट चलते हैं आपके पास, सीख के आते हैं कुछ.
अरे मोस्ट वेलकम, आ जाइए, अभी तो गर्मी बहुत है.
गर्मी तो सर यहाँ भी बहुत है, बुरा हाल है. ये तो थैंक्स टू our government जिसने हमारी को बिजली दे रहा है, regular no power cuts and we are enjoying.
चलिए डॉक्टर चंदोक, I will talk to you maybe later. अभी मुझे एक पेशेंट देखना है.
Sure. Thank you. Bye bye. Thank you. Thank you.
Thank you, sir.
Bye bye. Bye bye. हाँ जी पूनम, कविता.
Yes, sir.
Okay. Okay,
Yes,
sir.
sir.
Sir,
Okay, bye bye.
हमारी शक्लें क्यों नहीं दिख रही?
sir, wait a minute. Doctor, ये share करने के लिए ये recording has been done. What to be done more वो Dr. Muktinder sir ने बताना था मुझे. Dr. Muktinder sir अभी तक आए नहीं है.
वो
What to be
बीच
done?
में ना, बीच में निकल गए हैं कहीं, है ना?
I know. Yes, sir.
He left in between.
नहीं,
He
आए
left
थे बीच में. He was there because he
Yes,
sent
sir.
me a message when I was little
No, no.
late.
No, but then he mentioned earlier na, that he's going to make Dr. Poonam the host, and he will be leaving. He had mentioned this earlier
Okay, okay, okay.
in the beginning of the meeting.
चलो बढ़िया हो गया. आज एक तो डॉक्टर राव सर भी पूरा अटेंड किए हैं.
Yes,
और
sir.
डॉक्टर दीपक शर्मा बेस्ट पार्ट है, he was also attending. So
I attended his lecture in Hyderabad also, sir. It was very good.
अच्छा,
Very
हैदराबाद
nice.
आए हुए थे.
हाँ, he was
Yes,
there.
sir.
And बहुत मजा आया था.
तो
His lectures are really good, you know.
अभी मैं इससे जब बात करूंगा ना, तो आई एम गोइंग टू इनवाइट हिम टू चंडीगढ़ पर्सनली. जब भी इंडिया आएगा ना नेक्स्ट, तो इनको वी विल होल्ड किसी बड़े
सेमिनार
हॉल
भी कंडक्ट कर सकते हैं सर.
सेमिनार.
हाँ, जैसे पहले डॉक्टर
सेमिनार
खान का
करवाएंगे,
किया
सर.
था ना, जैसे डॉक्टर खान का किया था, उसका कर लेंगे बड़े वाला. और विल कॉल द
Yes, sir.
ऑडियंस ऑल ओवर नॉर्थ इंडिया.
Done, sir. Done, sir.
चलो ठीक है.
sir.
Right, sir. So,
Right,
Enjoy
sir.
your-
Right, everyone.
enjoy your Sunday evening.
Thank you, sir.
डॉक्टर
Thank you.
कविता,
Thank you, sir.
डॉक्टर कविता,
Yes, sir. Yes, sir.
देख तेरे को ना बहुत बड़ा जीएसटी समेत टैक्स लगाना है. तू यार हमको फिश नहीं खिला रही है. और क्या हंस देती है, बहाना बना देती है.
सर इतनी गर्मी है, थोड़ा सा
पूनम
weather
खाती नहीं
ठंडा
है,
हो जाए.
पूनम खाती नहीं है, इस करके वो
हम
बोलती
तो
नहीं है.
देखती भी नहीं है. दिखानी तो बहुत दुख की बात है.
वो मेरा साथ नहीं देती पूनम, क्योंकि वो खाती नहीं है.
वेदर को थोड़ा सा कूल डाउन होने दीजिए सर. We'll do it.
ठीक है.
Okay.
तुम नहीं,
Right.
but you Bengali people, you don't take fish in गर्मियों में.
Yes sir, we take it, but जो जिस स्टाइल में हम लोग खाते हैं सर, आप नहीं खा पाओगे. Because हम लोग बिना इतना मसाले का बनाएंगे ना, we make it very it's more like क्या बोलूं सर, stew types. बहुत पतला होता है. Like it is not the gravy, thick gravy and all that.
गुड इवनिंग चंदोक सर। बंगाली तो मछली के बिना रहते ही नहीं है।
हाँ, मैं वही तभी तो पूछ रहा हूँ। ये तो
उनको
घर
तो
में भी
खुशबू से ही उनका
पूनम
पेट भर जाता है। मछली की खुशबू आनी चाहिए।
पूनम
यस सर, यस सर।
मैंने बंगाली फैमिली देखी है 2 फेज में। उनकी वन कैनाल हाउस है, उन्होंने पीछे पॉन्ड बनाया हुआ, फिशेस पाली हुई हैं।
Oh my God.
अपने वो फिश सीड डालते रहते हैं, खाते रहते हैं।
Oh my
ओन
God.
प्रोडक्शन।
That's what.
किचन
Very
पॉन्ड हो
nice.
गया। हेलो,
आज तो रजनीश भी था।
गुड इवनिंग सर। सर वो
हाँ.
शेयर कैसे करना है? मेरे को वो नहीं करना आ रहा, या तो आप कर दो 1 मिनट आके।
डॉक्टर मुक्तिंदर है।
वो जो मीटिंग है, रिकॉर्डिंग तो हो गई उसकी, तो
Yes,
रिकॉर्डिंग
I think
कैसे
so.
मैंने सेव करना है वो मुझे। हाँ जी, हाँ जी, हाँ जी, खत्म है।
डॉक्टर मुक्तिंदर है।
बस फिर ठीक है। तो सर आई वाज आस्किंग डॉक्टर मुक्तिंदर सर की कैसे करनी है सेव, तो वो कह रहे वो मैं ही कर सकता हूँ, तो उन्होंने कर लेंगे, वो शेयर करेंगे एंड सेव करेंगे इस मीटिंग को, बिकॉज
ठीक
रिकॉर्डिंग
है।
हैज बीन डन।
वो डॉक्टर आज तो डॉक्टर विठल भी पीप इन कर गया, देख गया है ना।
Yes, sir. He was there. Even Dr. Vital पहले भी आए थे जब वो जो skin
हाँ, वो
disorders के
आते
लिए
हैं।
first webinar पे भी आए थे.
अच्छा
He
अच्छा।
comes. हाँ जी, off and on he
उन्होंने
is there.
कॉम्प्लीमेंट भी दिया है कि लेक्चर बहुत अच्छा जा रहा है, उन्होंने मैसेज
मैं
में
तुम्हें
डाला है।
बताऊं, ये डॉक्टर सोफत ने मेरे को ना 2 महीने पहले 3-4 बार फोन किया कि आप अपना जो बैनर बनाते हो उसके बैनर के 2-4 पुराने वाले मेरे को भेज दो। मैंने कहा क्या करने हैं? कहता हमने डॉक्टर तनवीर ने कहा कि पंजाब ब्रांच भी इस तरह का करो, तो मैंने उसको
हाँ.
भेज दिए।
Okay.
3 महीने तो हो गए हैं, बैनर बनाने उनका भी। अरे
But
it is not so easy for them to
copy and paste.
copy and paste. चलो जी,
चलो
ठीक है। All
ठीक है
right.
sir. Thank you very much.
Bye-bye.
Thank you sir.
Bye-bye.
Bye. Bye sir. Bye. Dr. Poonam, we leave the meeting now. Dr. Poonam. Dr. Poonam. Dr. Poonam.
I was not audible. Actually, mic was off. हाँ जी।
Doctor, we'll leave the meeting.
Yes, we will leave the meeting. Thank you, Dr. Dhari.
Thank you.
Dr. Dhari, तो हमने thank you नहीं बोला. We forgot to thanks him.
No, Dr. Dhari sir, मैंने
Sorry
आपको
sir. सारे भूल गए, आपको thank you नहीं किया हमने.
No, मैंने thank किया था.
अच्छा, आपने किया? Okay.
हाँ. During my vote of thanks, I thanked him first, ना, because इनका ही lecture, हाँ, इनका lecture, इनका topic.
Yes sir. Thank you very much. Sorry sir.
Dr. Poonam, ये गलती हो नहीं सकती. We cannot do this, ना. जो इतना अच्छा speaker आए हैं and he gave us such a beautiful lecture. We can't do this kind of a mistake.
बहुत अच्छा lecture.
Thank you so much,
Thanks
sir.
for
Thank you so
enhancing our knowledge. Thanks a
sir,
lot.
thank you very much, and please sir, again कभी दोबारा आइएगा sir, and give another lecture on another topic. Right sir? Thank you so much. It was really enhancing. It was an enhancement to our knowledge, sir. Thank you very much, sir.
Thanks a lot.
Thank you so much.
Thanks a lot, everyone.
Thank you. So, Dr. Poonam, we log out?
Yeah.
Okay, thank you. Bye.
Bye.